Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about some of the key takeaways from the proposed rule CMS issued for calendar year 2024 Home Health Prospective Payment System. Let's get started. On June 30th of 2023, the Centers for Medicare and Medicaid Services or CMS issued the calendar year 2024 Home Health Prospective Payment System or HHPPS rate update proposed rule, which would update Medicare payment policies and rates for home health agencies. This rule proposes a permanent prospective adjustment to the calendar year 2024 home health payment rate to account for the impact of the implementation of the Patient-Driven Groupings Model or PDGM. This adjustment accounts for differences between assumed behavior changes and actual behavior changes on estimated aggregate expenditures due to the implementation of the PDGM and 30-day unit of payment as required by the Bipartisan Budget Act of 2018, which amended Section 1895B of the Social Security Act or the Act. CMS previously finalized for calendar year 2023 a permanent adjustment that was half of the estimated required permanent adjustment. In addition, CMS is also proposing to rebase and revise the home health market basket, revise the labor-related share, recalibrate the PDGM case mix weights, update the low utilization payment adjustment or LUPA thresholds, functional impairment levels, and comorbidity adjustment subgroups for calendar year 2024, codify statutory requirements for disposable negative pressure wound therapy or dNPWT, and establish regulations to implement payment for items and services under two new benefits, lymphedema compression treatment items and home intravenous immune globulin or IVIG. The action CMS is taking in this proposed rule would help improve patient care and also protect the Medicare program sustainability for future generations. In addition, the proposed rule includes several hospice-related enrollment provisions. CMS believes these provisions would help protect hospice beneficiaries by more closely scrutinizing hospice owners and ensuring that they do not pose program integrity risks. Calendar year 2024 proposed payment updates and policy changes updates for home health agencies. This rule proposes routine statutorily required updates to the home health payment rates for calendar year 2024. CMS estimates that Medicare payments to home health agencies in calendar year 2024 would decrease in the aggregate by 2.2% or $375 million compared to calendar year 2023 based on the proposed policies. The proposed home health payment update percentage is a proposed 2.7% increase, which is approximately $460 million, accounting for an estimated 5.1% decrease as required by statute that reflects the effects of the proposed prospective permanent behavior assumption adjustment, which is $870 million decrease, and an estimated 0.2% increase that reflects the effects of a proposed update to the fixed dollar loss ratio used in determining outlier payments, which is $35 million increase. PDGM and behavior assumptions. On January 1, 2020, CMS implemented the Home Health PDGM and a 30-day unit of payment as required by Section 1895B of the Social Security Act as amended by the Bipartisan Budget Act of 2018. The PDGM better aligns payments with patient care needs, especially for clinically complex beneficiaries. The law requires CMS to make assumptions about behavior changes that could occur because of the implementation of the 30-day unit of payment and the PDGM. In the calendar year 2019 Home Health Prospective Payment System final rule with comment period, CMS finalized 3 behavior assumptions: clinical group coding, comorbidity coding, and the LUPA threshold. The law also requires CMS to annually determine the impact of differences between assumed behavior changes and actual behavior changes on estimated aggregate expenditures, beginning with 2020 and ending with 2026, and to make temporary and permanent increases or decreases as needed to the 30-day payment amount to offset such increases or decreases. Additionally, in the calendar year 2019 Home Health Prospective Payment System Final Rule, CMS stated that they interpret actual behavior changes to encompass both behavior changes that were previously outlined as assumed by CMS when determining the budget-neutral 30-day payment amount for calendar year 2020 and other behavior changes not identified at the time the 30-day payment amount for calendar year 2020 was determined. For the calendar year 2024 Home Health Prospective Payment System proposed rule, using updated calendar year 2022 claims and the methodology finalized in the calendar year 2023 Home Health Prospective Payment System Final Rule, CMS determined that Medicare paid more under the new system than it would have under the old system. CMS is proposing an additional permanent adjustment percentage of minus 5.653% in calendar year 2024 to address the differences in the aggregate expenditures. The proposed permanent adjustment of minus 5.653% includes the remaining minus 3.925% to account for calendar years 2020 and 2021 not applied to the calendar year 2023 payment rate and accounts for actual behavior changes in calendar year 2022. The law provides CMS the discretion to make any future permanent or temporary adjustments in a time and manner determined appropriate through analysis of estimated aggregate expenditures through calendar year 2026. As such, CMS is not proposing to implement a temporary adjustment in calendar year 2024. Rebasing and revising the home health market basket. Since the home health PPS was implemented, the market basket used to update home health PPS payments has been rebased and revised to reflect more recent data on home health cost structures. CMS last rebased and revised the home health market basket in the calendar year 2019 Home Health Prospective Payment System Final Rule with comment period where a 2016 based home health market basket was adopted. For calendar year 2024, CMS is proposing to adopt a 2021 based home health market basket, which includes proposed changes to the market basket cost weights and price proxies. Additionally, CMS is proposing that the market basket update for the final rule be based on the most recent data available at the time of rulemaking. Updating the labor-related share. As a result of the proposed rebasing and revising of the home health market basket, the proposed calendar year 2024 labor-related share or LRS is 74.9%, which is based on the proposed 2021 based home health market basket compensation cost weight. The current labor-related share is 76.1%. Additionally, CMS is proposing to implement the revised labor-related share in a budget-neutral manner. Proposal for disposable negative pressure wound therapy. In accordance with Division FF Section 4136 of the Consolidated Appropriations Act of 2023, CMS is proposing to codify statutory requirements for negative pressure wound therapy or NPWT using a disposable device for patients under a home health plan of care. The Consolidated Appropriations Act of 2023 requires that beginning January 1st of 2024, there is a separate payment for the device only. Payment for the services to apply the device is to be included under the Home Health Prospective Payment System. There are also changes to now report The disposable device on the type of home health claim most familiar to home health agencies. Recalibration of PDGM case mix weights. Each of the 432 payment groups under the PDGM has an associated case mix weight and LUPA threshold. CMS's policy is to annually recalibrate the case mix weights and LUPA thresholds using the most complete utilization data available at the time of rulemaking. In this proposed rule, CMS is proposing to recalibrate the case mix weights, including the functional levels and comorbidity adjustment subgroups and LUPA thresholds using calendar year 2022 data to more accurately pay for the types of patients home health agencies are serving. Request for information on access to home health aid services. CMS is soliciting comments from the public, including home health providers, as well as patients and advocates regarding information related to ensuring the appropriate access to and provision of home health aid services for all beneficiaries receiving care under the home health benefit. This proposed rule also includes additional questions regarding any notable barriers and obstacles to recruiting and retaining home health aides, as well as ways to ensure that home health aides are consistently paid wages that are equivalent to the other care settings and commensurate with the impact they have on patient care. Home intravenous immune globulin or IVIG items and services. As required under Division FF Section 4134 of the Consolidated Appropriations Act of 2023, CMS is proposing regulations to implement coverage and payment of items and services related to administration of intravenous immune globulin in a patient's home for a patient with a diagnosed primary immune deficiency disease or PIDD. Currently, Medicare pays for the intravenous immune globulin or IVIG product using the average sales price or ASP methodology, and the items and services needed for in-home administration of IVIG for the treatment of a primary immune deficiency disease are paid under the Medicare demonstration program. This demonstration program will end on December 31st, 2023, and the Consolidated Appropriations Act of 2023 establishes permanent coverage and payment of the items and services needed for in-home administration beginning on January 1st, 2024. Durable medical equipment, prosthetics, orthotics, and supplies or DMEPOS policy issues. Lymphedema compression treatment items. Section 4133 of the Consolidated Appropriations Act of 2023 establishes a Medicare Part B benefit for standard and custom-fitted gradient compression garments and other compression treatment items for the treatment of lymphedema that are prescribed by an authorized practitioner. Compression garments for treatment of lymphedema have generally not been covered by Medicare because prior to the enactment of the Consolidated Appropriations Act of 2023, there was no statutory benefit category for such items. This rule would address the scope of the new benefit by defining what constitutes a standard or custom-fitted gradient compression garment and identifying other compression items used for the treatment of lymphedema that would fall under the new benefit category beginning January 1st, 2024. The rule proposes that Medicare would cover gradient compression garments for both daytime and nighttime use, as well as ready-to-wear, non-elastic gradient compression wraps with adjustable straps and compression bandaging systems applied in a clinical setting as part of Phase 1 decongestive therapy. This rule would establish the initial healthcare common procedure coding system or HCPCS codes and the payment methodology for these items and propose how future coding, benefit category, and payment determinations for these items would be made. The proposed payment basis for lymphedema compression treatment items is the average Medicaid state agency payment amounts plus 20%. In the event that Medicaid state agency payment rates are not available, this rule proposes to base payment rates on the average of TRICARE and internet retail prices. If neither Medicaid nor TRICARE payment amounts are available, this rule proposes to base Medicare payment rates on the average internet retail prices for a lymphedema compression treatment item. Medicare definition of brace. This proposed rule would also codify the long-standing Medicare definition of brace to provide clarification on the scope of the Medicare Part B benefit for leg, arm, back, and neck braces, and as a result will classify certain exoskeleton type devices as braces for Medicare payment purposes. Safeguarding taxpayer dollars. DMEPOS Refill Policy. In response to concerns related to auto shipments and delivery of DMEPOS supplies that may no longer be needed or not needed at the same level of frequency/volume, CMS instituted policies to require suppliers to contact the beneficiary prior to dispensing DMEPOS refills. CMS is proposing to codify its long-standing refill policy with some changes. CMS is proposing to require documentation indicating that the beneficiary confirmed the need for the refill within the 30-day period prior to the end of the current supply. Additionally, CMS is proposing to codify their requirement that delivery of DMEPOS items, that is date of service, be no sooner than 10 calendar days before the expected end of the current supply. CMS is also seeking comments for consideration in future rulemaking on ways to balance beneficiary burden with the potential risks/burdens of not verifying the beneficiary's actual need for recurring supplies for certain individuals with permanent health conditions. Hospice enrollment provisions. CMS is also proposing several provider enrollment regulatory changes to prevent and address hospice fraud, waste, and abuse in the future. CMS believes that these provider enrollment provisions related to hospice ownership and management will strengthen protections against hospice fraud schemes and improve transparency. The proposed hospice enrollment related regulatory changes in this proposed rule include subjecting hospices to the highest level of provider enrollment application screening, which includes fingerprinting all 5% or greater owners of hospices, expanding the home health agency change in majority ownership provisions in Title 42 Code of Federal Regulation, Part 424, Section 550B to include hospice changes in majority ownership, and clarifying that the definition of managing employee in Title 42 Code of Federal Regulation 424.502 includes the administrator and medical director of a hospice. Other provider enrollment provisions. Finally, to further protect the trust funds and Medicare beneficiaries, CMS is proposing additional provider enrollment provisions which include but are not limited to the following: reducing the period of Medicare non-billing for which a provider or supplier can be deactivated under 424.540A1 from 12 months to 6 months, strengthening the program integrity safeguards associated with the provisional period of enhanced oversight under Section 1866J3 of the Social Security Act. This is it for today. Just so you know that I'm creating another video to discuss the portion of the CMS proposed rule for calendar year 2024 Home Health Prospective Payment System that talks about home health quality reporting programs. So please stay tuned for that video. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for watching. Bye now.